we will call the meeting to order. Sarah, if you could do a roll call to ensure who we have.
Sure. So, Ms. Bishop?
Yes.
Mr. Gale?
Yes.
Mr. Hamilton?
Yes.
Ms. Harding?
Present.
Thank you. Ms. Harris-Shallow?
Yes.
Okay. Mr. McPherson?
Yes.
Mr. McPherson?
Present.
Ms. O'Gorman?
Present.
Thank you. Ms. Oliver?
Here.
Mr. Smith?
Yes.
Mr. Valance?
No.
Mr. Vesna?
Yes.
Mr. Wilson?
Yes.
Okay, thank you.
Thank you, Sarah. As was noted on the bottom of the screen, remember that this Skype meeting is being recorded. With the eScribe, we are testing it out today. If you're not fully able to use it, that's fine. Take some time as you can if you have the opportunity to use some of the features to get a feel for it. We will all make some mistakes with it. Don't worry, this is our time to give it a practice. After the meeting is over, if people would take the opportunity to email me their thoughts on the process, how we could do better, how it went, if it did go good, let us know, and then I can review that with the team at the health unit. Item 2 on the agenda is declarations of conflict of interest, either personal or pecuniary. Do we have any?
None. So right now I'm seeing you're putting the meeting words up.
Correct. I've thrown eScribe up so everybody can see the agenda for those who don't have access.
Oh, I see.
And that's interesting because I still have everybody's picture on the screen.
I do, unless he does that.
I am hopping back and forth.
Okay, no, my screen hasn't changed. So be it, though. We'll keep moving on. Item 3 is approval of the agenda. It was moved by Ms. Wariwoda, seconded by Ms. Harris-Shallow. And if Ms. Stevens could read the motion, please.
Sure. So the motion is that the agenda for the regular Board of Health meeting to be held on May 20, 2020 be approved. And if you are using eScribe, you should be able to vote on the agenda. Oh, a few people voted.
I just got yes. Yes.
I'll just put my hand up.
Yeah.
We'll give everybody another half a minute just to work with it, see who can do it. And then for the difference, we'll ask Ms. Stevens to do a call.
Can we also just note if you're not speaking, if you could mute your mic, because people are getting interference on the other end apparently.
I hear birds.
Where's your mute button?
At the bottom.
Little
Microphone.
The little microphone.
Oh, I don't have a little microphone anymore. I got Janet and Lance covering my microphone.
Don, if you've got the iPad, just lift up at the bottom, and they should show again.
No, they're not. Just a second here. I've just got a full coverage of Lance and. Anyway, carry on. Oh, here it is. I finally got it.
Okay, Sarah, do we have 5 people who have voted?
That's correct. I'll read the names of everybody who hasn't voted. So, Mr. Gale?
Sorry, I was like, yes.
Okay, thank you. Mr. Hamilton?
Yes.
Mr. Shallow?
Yes.
Mr. Smith?
Yes.
And Mr. McPherson.
Yes.
And Ms. Oliver.
Yes.
And Ms. Harding for the agenda approval.
Okay.
Thank you. And Mr. Gale.
Yes.
Okay.
Yes.
Thank you. That's everybody. So the motion is carried.
Thank you. Next item on the agenda is information session. There's no information session scheduled for today. So we're moving on to the minutes of the previous meeting. And moved by Ms. Waring-Wodas, seconded by Ms. Bishop and Ms. Stevens. If you could read the motion, please.
Sure. So resolution 2, that the minutes of the Thunder Bay District Board of Health special meeting held on April 14, 2020 be approved. And the voting is open again as well.
Dave Hamilton, yes.
Push yes and then enter, submit.
I got it. Thank you.
Yep.
Okay.
So Ms. Stevens, we have the same four, so if you want to go through the list for the rest.
Sure. So Mr. Hamilton already approved. Ms. Harris-Shallow,
Yes.
Mr. Smith,
Yes.
thank you. Mr. McPherson,
Yes.
and Ms. Oliver,
Yes.
and Ms. Hardy. Thank you. And Mr. Gale.
Was that me? Sorry, Mr. Gale?
Yes, Mr. Gale for the minutes of the special meeting.
Yes. Thank you.
And that's everyone, so the motion carried.
Thank you. I think Ms. Stevens will just do the voice going forward since the majority are not able to participate. Item 5.2, that the minutes of the regular board meeting held on April 15th, and it's moved by Ms. Harris-Shallow and seconded by Mr. Valance. And if you could read the motion, please, Ms. Stevens, then we'll conduct the vote.
Sure. So resolution 3, that the minutes of the Thunder Bay District Board of Health regular session meeting held on April 15, 2020 be approved.
Yay.
Okay. And I'll just go through Mr. Hamilton
Yes.
and Ms. Harris-Shallow,
Yes.
Mr. Smith, Mr. Smith for the minutes of.
Yes. Yes.
Thank you, Mr. McPherson
Yes.
and Ms. O'Gorman,
Yes.
Ms. Oliver,
Yes.
and Ms. Harding. You already said yes for that one, so I'm going to mark that down. And Mr. Gale.
Yes.
Thank you. And so that motion is carried.
Thank you, Ms. Stevens. On to item 6, matters arising from the minutes. I've had no matters arise. There is no closed, item 7, there's no closed session scheduled. On to number, and no decisions of the board. We're into communication for information. First is 9.1, which is the first quarter interim financial statements. And Mr. Dill, you're up.
Okay, thank you. Through the chair. So I just have a few speaking notes on the report. So this is report number 22, 2020, and it's the interim financial report for Q1. So a few things to note is that we still have not received our official funding approval from the ministry. So these numbers are based on the budget that was presented and approved at the board meeting in November of 2019. So these are as at March 31st, and later in the meeting, we will have additional discussion on the impacts of COVID-19 to our financial results. So the province has announced additional funding to address the COVID-19 response, and administration is tracking those costs separately. It is expected that there will be an application process announced soon. This report assumes that we will be eligible for that additional funding, and any deficit as a result of COVID-19 would be covered through the ministry. So for our results as at March 31st, you can see we have a surplus of 110,000 at this time. So the key variance items to address are wages, which is a surplus of approximately 166,000. Now this is attributed specifically to vacancies, including our manager of foundational standards position that isn't filled, along with the associate medical officer of health. There are a few other timing issues that exist with regards to recruitments, leave of absence, etc., that also contribute to that number. And this is partially offset by the initial cost that we incurred with regards to the COVID-19 response in March. Purchase and allocated admin, you'll see a negative variance of 55,000, and it's partially due to timing of payments compared to budget allocations through the year. We do expect that the second quarter will look better in this area. Additional licenses did have to be purchased in order to start the COVID-19 response, so that has been included. Building occupancy is another area of concern where we were finalizing some of the renovation projects, and we had a slight overage with regards to snow removal during Q1. Other variances can be attributed to timing of spending as we start to ramp up for COVID-19 response. Materials and supplies, for instance, were purchased in advance, and items like training and travel were immediately put on hold in response to the pandemic, which you can see in the numbers through attachment 1. When we look at the 100% funded programs, now this funding will be spent and managed through the balance of the year as appropriate. Seniors dental is at this point the most significant variance. Now for one, our focus was on the setup and rollout of the program. COVID-19 has resulted in this program being put on hold. We are also still waiting to hear from the province with regards to the capital request associated with this program to build the dental suites that we have applied for. So that has also been put on hold. We're hoping to hear from them soon with regards to that. So those were the key items I wanted to talk about. As I mentioned, we can get in a little more detail about COVID-19 and projections later in the meeting. But if anybody has any specific questions, I'm happy to answer those. And I also have Dan Hrychuk, our manager of finance, here as well.
Thank you very much, Mr. Dill. Questions for Mr. Dill? There being no questions for Mr. Dill, then can we move on to item 9.2, and that's Dr. DeMille, the COVID-19 update.
Okay. So, thanks very much, Mr. Chair. Can you all hear me if I speak like this, or do I need to speak louder?
I can hear you. Is it 10.2? I've got 10.2.
I have 9.2.
Okay, is that good? I'll talk like this, and if you need me to speak up, just let me know. So I'm just going to start off with a bit of just an overview of where we're at and some of our current work that we're doing. A lot of this you might have heard about in the news or in the Premier's messaging and various messaging from the province. I'll then sort of get into kind of how we're moving forward and some of the implications of moving forward and what we might anticipate over the next several months. So the first thing I'll do is just a status update on the number of cases. So at the end of the day, yesterday, we had a total of 79 confirmed COVID-19 cases since the beginning of this pandemic.
77 of those are now considered resolved. Unfortunately, this morning we received 2 additional positive case reports, both from the Thunder Bay Regional Health Sciences Center, individuals that were tested. So we're actively following up on those. However, before this morning, we had really only had 1 case reported to us in the last week. And that reflects a declining number of cases that we were experiencing over the last couple of weeks, which is consistent to what was happening at the provincial level and even at the national level, that things were on the downside of the curve. Certainly the message is that the virus is here. It is still here. We were able to control it with all the public measures in place. However, it is still here. We cannot sort of get rid of it. I will point out actually that our overall incident rate is close to 53 per 100,000 population. The Ontario rate is 159 per 100,000 of the population. So in the Thunder Bay District Health Unit, we have about 1/3 the rate as the rest of Ontario. I'll note that our rate is fairly consistent across the north. So compared to there's 7 northern health units, and we're 3rd on the list in terms of the rate. Porcupine and Temiskaming health units are above us in terms of the rate, but we're all doing overall about 1/3 of the provincial rate. So I'll talk a bit about testing, because that is sort of the focus that we have both here and at the provincial level. We continue to do reasonably well with testing in terms of our numbers. The numbers, though, have been declining a little bit, as they have across Ontario in terms of people coming forward to test. However, we do refer people every day for testing. Our current testing rate, actually, we're near the top of all northern health units in terms of our testing rates. Northern health units are above the provincial rate in terms of testing. As you may know, recently we were involved in coordinating surveillance testing in long-term care homes. And the Premier a couple of weeks ago set a deadline of May 15th to have that completed. So we were successful in having that completed on time. We were early, in fact. And throughout that process, over close to 3,000, just shy of 3,000 were tested, staff and residents of long-term care homes. I believe we don't have all the test results back, but the ones that we have back, all are negative except one. That was the individual who was actually symptomatic at the time, staff person at Hogarth Riverview Manor, and of which the outbreak was declared because it met the outbreak definition. So that surveillance testing we accomplished quite successfully. At the same time, we were also doing infection prevention and control assessments with each long-term care home. So that was with Public Health Ontario and the Ministry of Long-Term Care Inspection Branch to do those assessments, and the reports are being finalized currently to provide, and that will provide guidance to the long-term care homes about infection prevention control practices and any particular strengths or any particular gaps or things that could be strengthened. This week we are doing the same assessments with retirement homes. Again, there's a check with Public Health Ontario. There's a checklist, so we follow a standardized approach to be able to do that. One of the things that we're waiting for at the present time, the ministry is analyzing all the results of the testing within long-term care homes and is hoping to generate from that analysis further recommendations going forward about settings and the appropriate testing for those type of settings like long-term care homes, retirement homes, and even other congregate settings. So we're in a bit of a holding pattern right now until some of that gets worked out. Related to that is other congregate settings, such as other supporting housing situations, and care situations. We've done considerable work with many partners, especially in the city of Thunder Bay, around the Vulnerable Populations Working Group. So basically planning to support individuals who are street involved with supports, including testing, access to isolation shelters, and working with the shelters to provide alternative accommodations. And that's with a variety of involved in that. There's also we've also developed a number of working groups or areas of focus, for example, daycares and schools. The announcement yesterday sort of took some of the pressure off with respect to the schools, but we continue to work regularly with the daycare sector and the essential daycares that are moving forward and that have moved forward. We do continue with having what essentially is our complaints line and following up with public health inspectors with any sort of progressive enforcement to ensure people are compliant with the orders and the expectations around physical distancing, for example. And we do a lot of education and awareness building through that particular process, as well as helping places address the issues. And as you are aware, there is increasingly businesses and other places being reopened as part of the government's plan to reopen Ontario. And so we continue to sort of navigate through that and provide people any sort of advice or guidance, although there's a lot already out there from the various ministries and other sectors. And we continue to do a lot of communications. In fact, we've realigned our communications and promotion messaging to a number of different targeted areas, and allocated staff to that so that we move forward. I will point out our epidemiologists are hard at work around our data and managing the data. And just last Friday, we launched a different format on our website to present our current situation. So I would encourage you to look at that. It will show more information about just the trends and our cases and the dates that they were reported, as well as our testing numbers. Related to indicators and data management, we are working with the province, but also ourselves internally to look at what indicators we may need to continue to monitor monitor the situation in our communities, but also sort of our own performance, for example, on case and contact management, which is crucial as we move forward. And I've already mentioned about the importance of ongoing testing. So, my computer is just going to read off my computer. So I just want to give you a bit of a picture of what I see going forward. Basically, we're at the end of the beginning of this pandemic. So we really successfully, I think, navigated wave one of this, or the initial wave of the pandemic. And we see that through declining numbers. But we are now moving into a state of what I call the new normal. So over the next, hopefully it will be several months, but we will need to continue to do and support testing initiatives, and we will be following up on a variety of varying numbers of case and contacts of COVID-19. So do expect that we will continue to see cases. We'll need to do the aggressive follow-up on them and the contacts to limit the spread. It's uncertain, especially with the reopening, just what the numbers of those are going to be. The fact that we will see occasional clusters, or what we call small cases and even outbreaks. And we will have to align public health activities to be able to manage this, especially as we open and close. Things are potentially reopening. We do aim to deliver other public health programming, so and we're looking currently at what can be delivered, although much of it will still be a modified or alternative form of that programming, and that includes health protection programming, such as immunization programming, which has been deferred at the present time, are suspended at the present time, as well as other health promotion programming. So the aim over the next several months is to be able to continue a strong response to like case and contact management and outbreak management for COVID-19, but to do so in a sustainable manner, recognizing, however, the fundamental uncertainty and unpredictability as it relates to this pandemic. And of course, at the same time, trying to deliver other public health programs and services as well. Thing that we want to be doing at this time is also preparing for another surge or what could be the second wave of the pandemic. Sometimes people consider that might happen in the fall. I think it could happen even earlier than that, but it follows other respiratory viruses, and it would be potentially in the fall. So this could be a second wave of the pandemic. This won't just be in this area. This would likely be something where we will see a global kind of resurgence of this virus, and national, and the province will be impacted too. And again, we would anticipate that more significant public health measures would be reinstituted, and we would see in some ways similar to the first wave, the kind of disruption. So we're trying to sort of look to how to prepare for that as we navigate this new normal situation in the meantime. So we're working, and Lance could speak more to this, but certainly in terms of our human resources and our financial resources, we are looking at how best to manage through this, again, in a sustainable way. For example, we're looking at vacation schedules of staff currently, and hoping that all our staff would be able to take some vacation time over the summer in a manageable kind of way, but still allowing us to put on a COVID response as we need to. And additionally, we're also looking at managing our human resources in terms of potential other positions we will need to add, even on a temporary basis, just to be able to support our ongoing ability to manage the COVID response, as well as other programming as well. So that's my update. I would be happy to take any questions.
Thank you, Dr. DeMille. This is for the group. This is our opportunity to pose questions to Dr. DeMille. So the floor is open.
Chair, it's Norm.
Go ahead, Norm.
Okay, thank you, Chair. Thank you, Dr. DeMille. I wonder if you could comment on the role of paramedics in testing and the utility of that, especially given that all the municipalities on this board pay into Superior North EMS, and it's really owned by all of the municipalities. How beneficial is it? How effective is it? And what would happen if the paramedics weren't doing that? And this is not a staged question, by the way. I've just been interested in this. So Dr. DeMille was not set up for this.
So maybe I'll start, and then Tennille Rabichuk, I think, is online. I think she's one of those boxes, but because she's the one who's the operation lead of our IMS, but I'll wait. I guess I can't tell if she's on, but I would say that we have a very strong working relationship with community paramedicine, and we've been able to, we refer individuals to them, and on a continual basis. It's very helpful that that program, that the individuals could go right to somebody's home if somebody, and for whatever reason, they're the ones that are testing the children, because with that, children can't be tested through the assessment center. They've also been engaged to do some of the testing in long-term care, including with the staff of long-term care. And they were available for us here in Thunder Bay when we did the drive-through testing. And maybe what I'll do is I'll stop talking and see if Tennille has anything further to add.
Sure. So, yeah, this has been a really important relationship that we've had with community paramedics. Along the way, there has been some limitations to access to the assessment center. And one of them, like Dr. DeMille just mentioned, was some age restrictions and at different points in time, symptom restrictions. So the community paramedics, there was access through that program. And I just kind of echo all the things that Dr. DeMille just mentioned. It's been, I don't think that we could have actually managed this outbreak in the same manner without that relationship.
Very good, thank you. And Dr. DeMille, the municipalities have been quite flummoxed in provincial announcements and lifting of restrictions without any notice. Yesterday and today have been quite hellish for us. Everybody thinks that parks and stuff are open now, and in Thunder Bay they're not. Anyway, are you being the medical officers of health getting any advance notice or any indication as early as to when announcements are being made?
So thank you for that question, Mr. Gale. I would say we are hearing stuff through the Ontario News media releases more often than not. Sometimes we do have indication that something like that, we knew, for example, that there would be an announcement about schools this week, which there was yesterday, but we didn't know what that would be until we heard it. And I do know we are challenged by the same things in terms of what are likely the same things in terms of really understanding the detail behind what's opened and what's not, and knowing that. So yes, I think that remains one of our challenges, both with respect to the reopening, but even some of the direction, as I've mentioned, around testing and what we're expected to do around testing. Yes, sometimes just the messaging isn't clear.
Okay, yeah, I don't know if you're frustrated, but we're quite frustrated, and it makes it difficult, a difficult situation more difficult. Chair, finally, one final comment. Thank you, Dr. DeMille, for your leadership through all this. I really appreciate your style, and I appreciate your public messaging. I think it's been strong and spot on. And also, those two fellas you got on Twitter there, whatever the heck they're doing, that's entertaining as all hell. And they got some talent. Every once in a while I see them, and I try to retweet it. But anyway, good stuff.
I thought he was in the room with me, but he's not.
Chair, Kristen Oliver, I was wondering if I could ask a couple questions, please.
Yeah.
I
Kristen,
also have a couple questions.
Kristen, just a second. I can put you on the list. I've got two people ahead of you.
Okay.
So first is Ms. Bishop, then Ms. O'Gorman, and then Ms. Oliver. So Ms. Bishop.
Okay, thank you very much. Just a couple of points. It's around testing, and I'd like to know where we're at with testing, meaning in the beginning, we take our samples and we send them to Toronto, and it takes 4 to 6 days. Then Dr. Kennedy was speaking of waiting for some agar plates and some different equipment to come to the hospital so testing could be done in 4 hours. Then Dr. Kennedy was speaking to the fact that Ontario wanted to set up a testing place here in a building. I think it was supposed to be, well, somewhere Thunder Bay South. Where are we at with that speed of testing, and where are they being done, and do we have a facility of our own yet?
So thank you. So the Thunder Bay Regional currently has in-house testing available. They're actually getting additional test equipment to be able to do another COVID-19 test. And I heard this morning that they may have all of that in place by next week. So they are able to do some of that testing, and they have been doing some of that testing in their facility. They are a little bit limited on the numbers, but with the new equipment that they're getting for next week, we do anticipate that will ramp up. I believe I heard it was at least an additional 180 that could be done per day next week once they have the other equipment. With respect to the Public Health Ontario Lab, so PHOL, so run by Public Health Ontario, there is a regional lab here in Thunder Bay. It is on the south side. They apparently right now have the equipment to be able to do the test, but there are some technological things that need to be in place and some additional work that needs to be done. I heard at one point that would be started next week. I'm now hearing it might be delayed, but certainly I think that there is commitment, because I know Dr. Kennedy and I did speak to somebody at PHO to be able to advocate for that. And once that regional lab is up and running, they will be able to accommodate 400 tests per day. So between the Thunder Bay Regional and that facility, that's, I think, quite reasonable capacity for testing and getting a good turnaround time. Just if I may elaborate a little bit, like a more, with the new data system, we can actually monitor for the turnaround time. The goal, I believe, at the provincial goal is to have test results back within 24 to 48 hours. And the best, sorry, I'm looking at okay. We're not there yet, but my computer, okay. When I look at the turnaround times, because I now have, and I just got this list yesterday, we're approaching an average of being at 2 days, but we're actually anywhere between 2 to 4 days as the average turnaround time for the test. So some inconsistency there, but I think we're progressing in the right direction to be able to improve on that.
Okay, and there's just a secondary point, if I may, it's short. The 2 cases that you said now we have additionally today, and they're at the hospital, were they 2 cases that were just just gone in for testing and put in the hospital, or were they people working in the hospital, or where did they come from?
So I don't have that level of information. I know they're not staff people at the hospital, because we would hear about that in a different way. So they're community.
Thank you.
Thank you, Ms. Bishop. Ms. O'Gorman, you're next.
Okay, my question's related to data management, and it's for Dr. DeMille. One of the, probably 2 of the unintended consequences of listing positive COVID cases as Thunder Bay and area is that we've noticed in the rural areas that people think it's not in our area, and I'm speaking for Gillies and Nebin townships, and so they perhaps aren't practicing social distancing to the degree that needs to happen. The other dynamic is that city dwellers are coming to rural areas to use services and aren't practicing social distancing to the degree it needs to happen. So I'm wondering, or councils have been wondering, if the health unit has given consideration to listing those cases differently. One category for the city of Thunder Bay, a different cluster for the townships, and a different cluster for the unincorporated, so that people can be more aware of what's going on and perhaps more transparent with the information. Could you give us some comments on that?
So I think in terms of, so thank you for that question. I think in terms of how we're moving forward, we're looking at different ways of being able to do that. And certainly we do want to get the message out that this virus is anywhere, and people need to treat it that way. There's no place that's sort of safe to be in at the present time in terms of avoiding the virus. And there might be ways of getting that message out, including providing more information on the 79 cases that we currently have, but more as an aggregate and not specifying, case number 50 or 51. I think we have a challenge in that when we identify cases, 2 specifically, especially when they're first reported to us, We have had people's privacy challenged significantly in some very concrete ways. So when we announce a location, when we're announcing a report, people immediately sort of get suspicious, and I think we've learned from that, and unpleasant experience that some people have gone through as a result of that. But I do agree, even just breaking it up between Thunder Bay and the surrounding communities might be one good way of dealing with that. And so we are looking at that and considering how we might do it.
Thank you.
Ms. O'Gorman, did you have a second question?
No, I think that addresses it in terms of going forward, taking a look at how to do a cluster differently so the messaging is more accurate. Thank you.
Thank you, Mr. Gorman. Ms. Oliver, you have a question or two.
Thank you, Mr. Chair. So I did have questions around the testing piece, so thanks for answering that already. But I just wanted to talk about what your ability or capacity is to determine regulations and protocols that should be put in place. Do you have, if we do start seeing a spike in issues specifically in this area, in this district, do you have the authority to start implementing new, like a shutdown or a protocol that way so that we could try to minimize spread?
I can make strong recommendations that certain things be done. I don't believe I, as the medical officer of health, can order something. I believe my colleagues have looked at different ways that they might be able to do that. I think one of the ways, though, is a city bylaw could pass certain things where it might be appropriate.
Perfect, thanks for that. And also, apparently, I guess I received an email from another counselor today that Dr. Tam is now suggesting that people wear masks when they're in situations where they cannot be able to physically distance themselves, or like on transit, in public spaces. What are your thoughts on that, and is it something that we should maybe look at as a board, or even as yourself, to say we should really give masks some consideration?
So my messaging, I mean, I think that's the similar messaging that we've already been promoting, is wearing masks when physical distancing is not necessarily possible, or that appropriate physical distancing is not necessarily possible, such as sort of going into a more crowded area. So that has been our messaging, and in fact, one of the most recent videos that was acknowledged before by those two guys actually was about masks and wearing it properly. My messaging, and I have to run this because Lance is the communication guy, my messaging has been to just that, to wear a mask where you're in a situation where physical distancing isn't necessarily possible, or appropriate physical distancing. But it shouldn't, it doesn't, you should still try as much as possible, like do all of those other measures. Like it doesn't, not wanting to give people a false sense of security when they wear a mask. And in fact, I was on CBC yesterday morning with Lisa Lacko, and I mentioned, that I carry a mask around in my purse, so that if I'm going somewhere, and it's a homemade mask, but if I'm going somewhere where I can't physically distance, I would wear the mask.
Perfect. And I really appreciate that. And I was hoping you would say what you said, especially around the piece on the giving people a false sense of security. I think that that's something that the messaging really needs to be reinforced, that even if you're wearing a mask, you still have to be washing your hands, not going out when you're sick. And I think that that's the key point. So thanks again for reiterating that. That's it.
Thank you, Ms. Oliver. Dr. DeMille, a comment from my world. I'm seeing some of the stores saying, well, you need to wear a mask to get in. The dilemma I'm running into is, if I don't know how to make a mask, in Greenstone, I can't buy a mask. So I think, as Ms. Oliver just said, we need to certainly put out social distancing, hand washing, because masks are certainly not available for lay people.
So there's other ways, I'm just, maybe, can you answer that? I don't know if there's sort of communication stuff.
Well, so our communication strategy, when we're looking at things right now, we are promoting physical distancing, washing your hands, all of the IPAC measures first. And then, like Dr. Jamil said, if you are in a situation where you can't appropriately do that and you have a mask, you can wear it to protect yourself. Our team has been on several calls with the ministry communication group across the province talking about that exact issue, Mr. McPherson, about accessibility of masks, and even when you're looking from an equity perspective for the vulnerable populations who don't necessarily have the means to purchase masks even if they were available. So that is on the provincial radar, and we continue to promote the physical distancing and other IPAC measures as the first resort.
Thank you, appreciate it. Other questions? There being no response, let's move to 9.3.
No, sorry, James, I had the mic off. It's Alana.
Yes, ma'am.
Just short note about masks. I have $80 flying out there on the internet somewhere waiting for masks from China. I guess they're from China. And they were ordered about 6 weeks ago, you know, so people get stuck in this dilemma of the masks, even though you think you're going to get them. And it's awful hard. Yeah, that's it.
Thank you, Ms. Bishop. Mr. Dill, 9.3, the implications financially for COVID.
Thank you, Mr. Chair. So this memo is meant to provide you some information on the financial implications of our COVID-19 response to date and what we're anticipating for the balance of the year. Obviously, there are several assumptions in this, including what we expect to happen with cases and in the region. So as I mentioned earlier, the province has announced additional funding to address the COVID-19 response, and we do track all of our costs associated with this separately so that we are prepared when the application process is announced. This report does assume that we are eligible for the additional funding, and as I mentioned earlier, any deficit as a result of COVID-19 will be covered by the province. The ministry, along with some of our other funding, has provided us some additional flexibility with regards to our funding. So we are allowed to use, a good example of this is HVHC positions are currently not able to run that program in its entirety. So we have been able to second those positions for COVID-19 response, and they've given us permission with the funding to do that. So a few things that I wanted to highlight were the projected cost at the time this memo was written are just over $800,000. Now the majority of this is wages, including overtime, some additional contract nurses, program support, and other positions that we feel may be necessary throughout the year. We did have to purchase additional equipment from an IT perspective to move people to work from home solutions. We also had some fees related to work from home policies, setting up accommodations for the staff that required that, staff assessments, and some of the Emergency Act issues that created some potential issues in our programming. Obviously, things like additional cleaning have also occurred throughout the building, and we've made some modifications to our regular schedules for that. Additional materials and supplies have also been purchased that were necessary to deal with the surge in the workload. So these costs only represent our extraordinary costs, so those over and above our recognized budget. So if someone is fully redeployed to COVID, the portion of their salary that was included in your approved budget is still being charged there. These just represent the cost over and above what you have approved as a board in November. So this projection of $800,000 has already been and will continue to be offset somewhat by the fact that not all programs are running at this time, or they're running but on a slightly modified basis. So administration is currently looking at program restarts, as we've mentioned. The VPD program is one in particular, and when those will happen, to see what kind of capacity we have. So that's an active discussion that's happening around the table right now. So I'm more than available to answer any questions you may have on the impact to date and what we see going forward.
Questions for Mr. Dill? There being none, then before we go to the next meeting and adjournment, I would remind everyone, please take some time today or tomorrow, send me your thoughts on how the meeting went and other options if you have other options. Then item 11 is adjournment. It was moved by Mr. Smith, seconded by Ms. Bishop. And Ms. Stevens, if you could read the motion and do the roll call.
Sure. So resolution 4, that the Board of Health meeting held on May 20, 2020 be adjourned at 2:01 p.m. And so.
And if we could do the roll call, and then we can
Sure.
have our day done.
Ms. Bishop.
Ms. Bishop, I think you're on mute.
Yes.
Okay, sorry. Okay. And Mr. Gale?
Hello?
So I don't think Mr. Gale is.
Sure, one moment.
Mr. Hamilton?
I'm just on a call, but let me grab him 1 second.
Okay, Mr. Hamilton, are you there?
Yes, can you hear me?
Yeah, there you go. So for adjournment?
Yes.
Okay, thank you. Ms. Harris-Shallow?
Yes.
Mr. Smith?
Yes.
Mr. Valance?
Yes.
Thank you. Mr. McEachran?
Yes.
Thank you. Mr. Vesna?
Yes.
Okay, thank you. And seeing Ms. Oliver, are you there?
Yes.
Okay. And Ms. Hardy? Okay, thank you. And
Chair, it's Norm. I just wanted to let you know I'm back. Sorry, I stepped out.
okay, and for we're at the adjournment. So, are you in favor of adjourning?
I just got back. Good to see you all.
Mr. McPherson?
Yes, ma'am.
Can I just confirm the date for the next meeting, please?
June 17th.
Thank you. Thank you very much.
Should be June 17th, 1 o'clock, and as we get closer, we'll just know what format we're going to be able to use.
Okay, thanks a lot.
So, Ms. Stevens, have we got the list?
Yes, we have everybody, and the motion carried.
Meeting is adjourned. Thank you, everybody. Please do send me your thoughts. Thank you.
All right.
Bye, everybody.
Thank you, everybody.
Stay safe, everybody.
Bye, everybody.
Thank
Bye.
Stay safe.